COVID-19 lung disease, as far as I can see, is not a pneumonia and should not be treated as one. Rather, it appears as some kind of viral-induced disease, most resembling high-altitude sickness. It is as if tens of thousands of my fellow New Yorkers are on a plane at 30,000 feet and the cabin pressure is slowly being let out. These patients are slowly being starved of oxygen. I have seen patients dependent on oxygen take off their oxygen and quickly progress through a state of anxiety and emotional distress and eventually get blue in the face. And while they look like patients absolutely on the brink of death, they do not look like patients dying of pneumonia. I have never been a mountain climber, and I do not know the conditions at base camp below the highest peaks in the world. But I suspect that the patients I'm seeing in front of me look most like as if a person was dropped off on the top of Mount Everest without time to acclimate.
What happens is when radiation is coming into your body from a cell tower, from Wi-Fi, from a cell phone, that radiation damages the membrane of the cell and it creates cells like this. You see, and you're probably wondering, what do healthy cells look like? You see, so I need to show you that, because this is what healthy cells should look like, right? Let's see if I can find it. Right there. They should be even in color, even in shape, even in size, living in their own space. So when the membranes are damaged, we have what is called reverse polarity. What is normally positive on the inside, negative on the outside, the polarity switches from positive on the outside, negative in the inside, and causes the cells to start sticking together. So now they look like this. You see, they're all chained together. You see that?
Yes, we do.
Okay, so when cells are chained together, they can't go into the pulmonary system to pick up oxygen. So when you have this so-called corona dis-ease, it's not an infection, it's an outfection caused by contributing factors that are spoiling your environment, causing the corona effect, causing cells to reload or stick together so they don't circulate to your feet, to your head. So you have lightheadedness, you have cold hands, cold feet. You start having congestion because the body can't maintain its alkalinity because the body fluids cannot flow. They can't flow because they have to go in single file. And they're all stuck together. So they're stuck together. They can't pick up oxygen from the lungs in a group. They have to pick it up individually, and then they come back out.